Hi, I'm Paul Halverson, and it's a pleasure for me to serve on the governing board and our Restart Committee here at Castleton. This is such a wonderful church with great church members, friends, and family. And I was asked today by Pastor Jen to talk a little bit about the overall situation as it relates to COVID-19. As many of you know, I'm the founding dean and professor at the Richard M. Fairbanks School of Public Health at Indiana University here in Indianapolis. And in that capacity, we do a lot of work with our state Department of Health and the governor, as well as local health departments across the state, and especially here in Marion County. So it's safe to say that I spent a lot of time talking about and studying and working with colleagues around COVID-19. It's sort of been our life for quite a while. And it's important to say that I think it's affected all of us in many, many different ways. Well, and you know, if you've been paying attention to the news over the last couple of weeks, we're really increasing in our number of cases. And unfortunately, we're going in the wrong direction as it relates to the vulnerable people that are most affected by this pandemic. So there's a lot of things that I want to say, but I'm going to try to be very brief today just to let you know that we're entering a time where we're actually worse than we were before. And this is a time when we have to be very vigilant. And so as a church, it's important to recognize we've never been closed. This is a time when we have had to adapt. And I don't know about you, but I've been so proud of our church in terms of how we've worked to try to be very cognizant of the disease, but at the same time trying to create new opportunities for worship and for service and connection. So right now, in the last week, we've seen a 20% increase in the number of cases. We've also seen an increase in the percentage of our older adults that are being positive. Now, this is important to note because in the last month, we actually saw substantial increases in the number of people that were younger, particularly as we started college and our elementary schools, high schools back again. We saw those numbers increase. Well, what's happening now is that those numbers are down, and the percentage of people that are positive that are over age 60 have increased fairly substantially. The bad news about that is that we know, based upon our research, that the older you get, the more likely you are to have serious complications from this disease. And frankly, based upon the work that we've done, the difference in serious complications and death rise very, very dramatically as you're over age 60. And so as we think about opening and reopening the church, and again, we've never closed, but in terms of reopening to in-person worship, we have to be very cognizant of the fact that we need to in all ways, protect our fellow church members and friends and visitors. And so it's really important that we pay attention to doing things safely. Here's another thing that's really important to mention, and it's actually based upon research that was done here in Indiana, and right now we're the only state that has done a statewide prevalence study for the disease. We know two things that are really important for us here at this church to recognize. One is that for every person that has been tested positive, there's about 10 other people that haven't been tested, but they are positive. So back in April, we found that we had about 17,000 people that had tested positive. But based upon our research, there were about 180,000 people that were actually positive by virtue of the calculations of prevalence study. Why that's important is because we have a lot of people that are in our state that are positive and they don't know it. Now here's the other thing that's really important. They're positive, they don't have symptoms, and of course no one wants to pass on this disease, but we have about 40% of the people that have COVID with no symptoms. maybe over 40%. And so we've got to do our best to make sure that we're wearing our mask, doing social distancing, physical distancing, at least 6 feet, and also that we're washing our hands and just taking precautions. So at a time when I know we're all tired of COVID, we need to double down in our prevention measures. And that means here at church as well. I had a chance to talk with our wonderful choir just a couple of days ago, and they're so anxious to get back and do singing. But unfortunately, you know what? Singing is one of the most high-risk activities that there can be. And they would love to sing. And they sing on Zoom, and we hear it, and we're blessed by it. But for right now, particularly for our choir members that are over age 60, and for people that have underlying health conditions, that's a very, very risky activity. And in our building and with our choir, it just doesn't make sense right now. That doesn't mean that they can't participate and be actively engaged in our worship, and they are. And I thank John Perkins for his leadership in making that happen. But we need to, at all times, be very conscious of doing the right thing, letting science guide us, and and acknowledging our obligation to respect life, which is what we're all about. So I just wanted to say thank you for all of your faithful continuation of your service and for worshiping here at Castleton. I'm looking forward to the time we can all be together, but I'm telling you right now, it's going to be a while until we have a vaccine, until we are all taking that vaccine. We're going to need to continue to focus on being safe. And that's really, really important. Now, I'm sure Pastor Jen will talk about plans for the future, and we'll transition, but it's not going to happen overnight. And just because we can, and you may know that the Marion County Health Department and the governor and all have made arrangements and have guidelines for churches and so forth, but it really is left up to churches to do the right thing. And I'm confident here at Castleton, we will do the right thing. With your help and with your support, we're going to get through this together. So thank you, church, for giving me the opportunity to visit with you this morning.
Hi, church. You just heard Dr. Paul Halverson talk scientifically and compassionately about this season. Dr. Halverson told me this spring that we would see an increase by their calculations during the season where fall comes and flu season comes. So we have been waiting to see if that came to fruition as calculated by science, and indeed it has. And so I want to come before you and say, I too am frustrated and exhausted by this. It's hard. E-learning and balancing work is hard. So I come before you tired and sad, like you. I do want to say that we are continuing to be the church. And so a couple things I want to bring forth to you today. One, we continue to find new ways to extend our reach. That not being able to do what we've always done have created for us a need to figure out how to go outside our walls. And you have seen that with Sermon on the Mound, and you just saw it with Candy Caravan, where we had deeper community partnerships and farther reach than we have in our normal trunk or treat. And so I want to celebrate with you that because you remain faithful, we are indeed furthering the gospel of Jesus Christ. I also want to say that we are continuing to find new ways to meet. So windshield worship is a great opportunity, and it's continuing even in the cold on Sundays at 4. More and more groups, because of their short duration and their size, are meeting in the church, and we are dreaming and scheming some new ways to pull together people for the holidays and for worship in new and different ways, and those things are on the table and they will be coming to you. Live nativity is going to happen. In-gathering is going to happen where we drop off supplies for the needy. We are still in ministry. I also want to say to you, it is so easy to get out of the habit of the practice of our faith, of connecting to our home community, to searching and seeking for other ways to fill that void. But I want to come to you and say the thing we most need is to be near to our God and to the community with whom we are in covenant. That is how we feed our souls. That is how we find contentment and hope in the midst of this. So be diligent in your discipleship. Be diligent in connecting with your community. Be diligent in getting up and worshiping and connecting with the opportunities that continue to come forth in being part of the ministry here at Castleton. I do want to say to you that we love you and that we miss you more than words can say, and so many sleepless nights, because there's no great or right decision. No matter what decision we make, it's going to be the wrong one for some. But what we do know is that our faith demands that we have a reverence for life. As Methodists, that we do no harm, we do good, and we stay in love with God. And so we remain faithful to that. And sometimes being faithful is hard, but we will do it together as the community of Christ. We love you. We miss you. We'll talk to you soon.